Usually when we talk about a medical diagnosis, there is this expectation of precision, right? You want a clear answer.
Right. You want the doctor to just point at an image and give you the facts.
Exactly. I mean, you break your arm, the x-ray shows that jagged white line, and boom, broken or not broken. It's a clean, binary process.
But then you step into the world of certain sensory changes, and, well, suddenly that x-ray machine is completely useless.
It really is like, picture this. You are standing in front of your bathroom mirror, sticking your tongue out, shining your phone flashlight in there, and everything looks perfectly normal. Pink. Healthy.
Yeah, visual evidence of zero issues.
Right. But every time you eat or swallow or honestly just sit there, your mouth tastes like you have been sucking on a handful of old pennies. Or even worse, it feels like it is actively on fire.
And I have to say, it is a deeply isolating place for a patient to be, because the visual evidence simply does not match the physical sensation at all.
And you just end up feeling crazy. Well, welcome to today's deep dive. Today, we are on a mission to solve a highly specific, incredibly frustrating sensory mystery.
A very common one, too.
Extremely common. We're asking, why has your sense of taste suddenly changed? And why do you have this persistent metallic, bitter, or burning sensation in your mouth?
And to answer this, we've pulled together a really robust stack of research.
We have. We're looking at medical literature from the British Menopause Society, the National Institute of Dental and Craniofacial Research, several clinical dentistry journals, and insights from specialized women's health clinics.
What we found across all these sources is honestly a profound validation for anyone currently experiencing this.
Yes, absolutely.
This condition, which is known medically as dysgeusia when it's an altered taste, or burning mouth syndrome when it involves pain, is incredibly common. Yet, because the mouth looks normal, patients routinely start to believe it's all in their head.
So if you are listening to this right now and waking up with that coppery tang in your mouth, or feeling like you burned your tongue on hot coffee when you haven't drank anything, you aren't imagining things. It's real biology.
It is entirely physiological, yeah.
So to figure out why your sense of taste is broken, we have to look at how it actually functions when things are running smoothly. I mean, we tend to think of taste as just a direct interaction between food and our tongue, right?
Right, like a simple cause and effect.
Yeah. You put a strawberry in your mouth and your brain says sweet. But going through the sources, there's a vital intermediary step we just completely take for granted.
Saliva.
Exactly.
We view saliva as just moisture, like water. But the clinical data paints a much more complex picture. Dr. Shubnam Zai, who is a dental expert highlighted in our research, points out that saliva is literally a solvent.
Wait, a solvent?
Yes. It chemically modulates how we perceive sour, salty, and umami tastes. It's an active participant in the chemistry of tasting.
I was trying to visualize this while reading the reports, and I keep coming back to this analogy of a delivery van.
Oh, I like that.
Yeah, so think of it like this. You can eat the most beautifully prepared meal in the world. The packages of flavor are there. But if your saliva isn't there to break that food down and physically carry those microscopic flavor molecules into the receptors on your taste buds,
your brain is never going to get the message.
Exactly. The brain gets nothing. The packages just sit in the driveway.
The clinical data takes that delivery van concept a step further, actually. When your saliva production drops, which is a condition called xerostomia, your taste function isn't just, delayed, it is actively impaired.
Wow. So the mouth environment just totally breaks down.
Exactly. The chemical environment of the mouth changes so much that the receptors themselves cannot process the molecules correctly.
Which perfectly explains a really specific study in the literature regarding postmenopausal women and sugar.
Yes, that was a fascinating find.
Right. The research shows a measured, documented decrease in their physical perception of sweetness.
Because if the delivery van isn't showing up, the brain is receiving a muted signal.
Wait, let's unpack this for a second. So if I suddenly find myself craving way more sugary foods, it might not just be a lack of willpower. It could literally be because my mouth is worse at tasting sugar.
That is a biological reality, yes.
Yeah.
It fundamentally reframes dietary shifts in midlife. It's not necessarily a sudden lack of willpower or emotional eating.
It is such an aha moment.
Right. Your physiological environment has changed. Your taste buds are sending a weaker signal because of a lack of saliva. So you find yourself adding an extra scoop of sugar to your coffee just to make it taste the way your brain remembers it should taste. It's a biological drive.
Man, that reframing takes so much guilt out of the equation for people. But it brings up the next logical question. If a lack of saliva is causing this sensory breakdown, what is slashing the tires on the delivery van? Why does the mouth suddenly go dry?
Looking at the data, the primary suspect for many people, especially midlife women, seems to be hormones, specifically a drop in estrogen and progesterone.
I was struggling a bit, though, to connect the dots between reproductive hormones and salivary glands. Like, how does that actually work?
It comes down to cellular receptors.
Hmm.
We naturally associate estrogen with hot flashes or bone density, but the oral mucosa, that delicate skin inside your cheeks, on your lips, and under your tongue, along with your salivary glands, they are absolutely packed with estrogen receptors.
Really? Packed with them.
Yes. Estrogen basically dictates cell turnover and blood flow to those areas. It keeps those tissues plump, hydrated, and fully functional.
So just as a drop in estrogen might cause the skin on your face to lose elasticity and moisture?
The exact same cellular thinning is happening on the inside of your cheeks. Precisely.
That makes total sense.
During perimenopause, menopause, or even the intense hormonal swings of early pregnancy, estrogen levels drop and the salivary glands simply slow down production. The actual lining of the mouth becomes thinner, more fragile, and much more sensitive.
And the numbers are huge here. The sources say up to 1 in 3 women experiencing menopause symptoms report having a significantly dry mouth.
Exactly. And this is where the metallic taste specifically originates. Because it's not just that the mouth is dry, you know. The lack of saliva actively changes the pH of the mouth.
Makes it more acidic, right?
Yes, it becomes far more acidic. And that acidic shift is what directly triggers that phantom coppery aluminum foil taste, even when you are just eating something totally bland like plain oatmeal.
So it's a full chain reaction. The hormone drops, the saliva volume drops, the pH becomes acidic, and the taste receptors misfire.
That is the exact mechanism, yes.
Okay, so the metallic taste is one thing, but the sources point to something much more painful that can happen. Sometimes it goes way beyond a bad taste and turns into severe physical discomfort. This is burning mouth syndrome, or BMS.
Yes, BMS is incredibly distressing.
If the metallic taste is a glitch in the software, BMS feels like the hardware is actually short-circuiting. Reading about it, it sounds exactly like phantom limb pain, but located on your tongue.
That's a great way to put it, because burning mouth syndrome is actually classified as a neuropathic pain condition. The nerves themselves are malfunctioning.
So it's a nerve issue, not just a tissue issue.
Exactly. Estrogen doesn't just maintain the mucosal tissues, it acts as a protective buffer for the nerves that control pain and temperature in the mouth.
Wow.
Without that estrogen buffer, those specific nerves become hyperexcitable. They begin firing off danger signals to the brain when there is absolutely no danger present.
So your brain genuinely believes your tongue is touching a hot stove, even when you are just breathing room temperature air.
Yes, and the patient feels a very real burning sensation.
The sources mentioned a very specific timeline for this pain, too, which I found interesting. It builds as the day goes on.
It does. For the vast majority of sufferers, they wake up and the pain is relatively mild. But as the day progresses, the nervous system accumulates sensory input from, talking, eating, swallowing.
Right, just normal daily stuff.
Exactly. And because the nerve threshold is so low without that hormonal protection, the braining sensation compounds. It usually peaks in the late afternoon or evening.
And how common is this?
It affects up to 30% of postmenopausal women. And unfortunately, it can last for months or even years.
The psychological toll of that must be just immense, because it's completely invisible, you look fine. The literature highlights how frequently patients are told it is just stress, or they are misdiagnosed with oral thrush and given antifungal treatments that do absolutely nothing.
Which just adds to the frustration. Knowing that it has a name and a proven biological origin in your nervous system is a massive step forward for patients.
For sure. But obviously, estrogen isn't the only factor, right? What if someone listening is a 35-year-old man or a woman nowhere near perimenopause and they wake up tasting old pennies? What is stripping away their nerve protection?
Right, we have to look at the other causes. The medical literature categorizes this as secondary BMS, or secondary dysgeusia. When we rule out primary hormonal decline, we look at a lineup of secondary culprits. And the first and most common mechanism we investigate is nutritional deficiency. Specifically, zinc.
I noticed that. The sources kept emphasizing zinc over almost every other mineral. Why is zinc the linchpin for our sense of taste?
Zinc is strictly required by the body to produce a specific salivary protein called gustin.
Gustin.
Yes, gustin. And this protein is entirely responsible for the growth, maintenance, and repair of your taste buds.
Okay, so it's like the building block for the receptors.
Precisely. Taste buds turn over very quickly, They have a life cycle of about 10 to 14 days. If your zinc levels plummet, your body cannot produce gustin.
And without gustin?
Without gustin, your taste buds die off and they just cannot regenerate properly. The primary hallmark symptom of that cellular failure is a metallic taste.
Wow. So a simple vitamin deficiency physically degrades the taste receptors.
Yes. Deficiencies in iron, vitamin B12, and folate act similarly, though they tend to damage the myelin sheath, which is the protective coating around the nerves in your mouth.
Right. And that leads to the tingling and burning sensation like the short-circuiting we talked about.
Exactly. It exposes the raw nerve.
Okay, so vitamins are a huge factor. What about the medications we take? The literature lists an enormous number of daily prescriptions that cause this.
Medications are a massive factor, and they disrupt the mouth through a few different pathways. Take high blood pressure medications, for example, particularly ACE inhibitors.
What do they do?
Well, their chemical structure often binds to trace metals in your body, so they literally pull zinc out of your system, which indirectly causes that exact zinc deficiency we just discussed.
Oh, wow, it's a total domino effect. The blood pressure pill drops the zinc drop stops the gustin drop degrades the taste bud, and you end up tasting metal.
That is exactly how it happens.
What about antidepressants? They were also heavily mentioned.
Yes. Antidepressants, along with many antihistamines, often have what is called an anticholinergic effect.
Anticholinergic.
Right. It means they actively block the specific nerve signals that tell your salivary glands to produce moisture. They forcibly shut down the delivery vans, so to speak.
Oh, I see. So it just dries everything up at the source.
Exactly. And then we have treatments like chemotherapy and radiation to the head and neck. Chemotherapy drugs are designed to target and destroy rapid turnover cells.
Oh, and since taste buds regenerate every 2 weeks?
They are caught in the crossfire. They are destroyed alongside the cancer cells, which fundamentally alters taste perception.
That makes total sense, tragically. The sources also mention underlying physiological conditions. GERD, or acid reflux, seems obvious because stomach acid is physically entering the mouth and altering the pH environment. But viral infections were also highlighted.
Yes, and I think we all became acutely aware of this with COVID-19, but standard flu viruses can do it too.
How does a virus actually alter taste?
Viruses can physically damage the olfactory cells in the nose and the supporting cells around the taste buds. Furthermore, neurological disorders like Alzheimer's or Parkinson's can present with taste changes early on.
Really? Early on?
Yes. In those cases, the hardware in the mouth is perfectly fine, but the software, meaning the brain's processor center, is distorted.
So what does this all mean for the listener? If I have this metallic taste, and I'm trying to figure out if it is my blood pressure medication, a zinc deficiency, or a hormonal drop, do I run to the dentist or do I run to the doctor?
The clinical consensus requires a team approach, honestly. You want to utilize different diagnostic scopes. You typically start with your dentist to rule out local mechanical issues.
Like what kind of mechanical issues?
They will look for hidden gum disease, undetected oral thrush, or even a galvanic reaction.
Wait, what is a galvanic reaction?
It's essentially a tiny electrical current created when different types of metal dental fillings interact with your saliva.
You literally have a battery in your mouth.
Basically, yes. It can produce a strong metallic taste. But if the dentist gives your mouth a clean bill of health, you then move to your primary care doctor.
Okay, so you rule out the hardware issues with the dentist, then check the systemic fuel levels with the doctor.
Exactly. The doctor will run a comprehensive blood panel to check your zinc, iron, and B12 levels. They will review your daily medications to see if there is an anticholinergic culprit, and they'll evaluate your thyroid and glucose levels.
Knowing the why is incredibly validating. But I want to pivot, because the sources dedicate a significant amount of space to actionable relief. And that's what people really want. How do we put out the fire and get rid of the heavy metal concert happening in our mouths? Let's look at the everyday lifestyle interventions first.
Absolutely. And one of the most immediate behavioral shifts involves something you do every single day. The utensils you use to eat.
Yes, I found this fascinating. The research explicitly suggests putting away your metal forks and spoons and switching to plastic or bamboo utensils.
It makes a huge difference.
Because if your taste receptors are already misfiring and generating a metallic flavor, introducing actual stainless steel into your mouth just amplifies the sensory confusion, right?
Right. Switching to plastic breaks that feedback loop immediately. It is a simple, highly effective mechanical fix.
I love that.
Yeah.
What about what we're actually eating?
Well, we also have to regulate food temperature, particularly for those dealing with the neuropathic pain of burning mouth syndrome. Remember, the nerves are already hyper-excitable.
The hot foods are a bad idea.
Very bad. Hitting them with a steaming bowl of soup or hot coffee aggravates the tissue further. Relying on cold or room temperature foods and sucking on ice chips throughout the day physically numbs the nerve endings and provides desperately needed moisture.
I did notice a slight contradiction in the sources regarding specific flavors, though. Some guidelines highly recommend eating citrus, while others explicitly say to avoid it at all costs. What's the deal there?
It depends entirely on which specific symptom is dominant for you. If you are primarily dealing with the metallic taste, the dysgeusia sharp, tart flavors like lemon water or sour candies are highly effective.
Oh, because the acidity cuts through the metallic flavor.
Exactly, and it actively stimulates the salivary glands to produce more moisture. However, if you are suffering from burning mouth syndrome, your mucosal tissues are already thinned out and inflamed.
Ah, so introducing acidic foods like citrus, tomatoes, or spicy dishes will chemically irritate the raw tissue.
Exactly, it will just make the burning much worse.
Okay, so the rule of thumb: sour cuts the metal, but bland and cool puts out the fire.
Precisely.
Another practical tip from the sources was chewing sugar-free gum, specifically gum containing xylitol. I guess the mechanical act of chewing forces your glands to produce whatever saliva they can.
Yes, and xylitol is key because it prevents the cavities that inevitably form when a mouth is chronically dry.
The sources also strongly advise ditching alcohol-based mouthwashes, which makes sense since alcohol strips away moisture. But they also said to take a hard look at your toothpaste. Why? Toothpaste.
This is a crucial, often overlooked intervention. Most commercial toothpastes contain sodium lauryl sulfate, or SLS. It is the chemical agent that creates that satisfying foaming action when you brush.
Right, we all love the foam.
We do, but SLS is a known irritant. If the protective mucin layer of your mouth is compromised, or the tissues are paper thin from a lack of estrogen, that foaming agent chemically burns the mucosa.
Wow, so you're just irritating it twice a day.
Exactly. Switching to an SLS-free brand, such as Sensodyne Pronamel, removes that daily irritant and allows the tissue to calm down.
Okay, so those are the everyday fixes. But if we move into the clinical medical treatments, what are the options? Say the root cause is a hormonal decline during perimenopause. The literature heavily discusses hormone replacement therapy, right?
Yes. By systemically boosting estrogen levels, HRT can increase salivary estriol. This basically thickens the oral tissues back up and restores the protective barrier around those oral nerves. It's a foundational fix for many women.
But what if HRT isn't an option for someone, or the patient is dealing with pure neuropathic pain driven by something else?
Yeah.
How do doctors actually treat the misfiring nerves?
They utilize neuropathic pain medications that recalibrate how the brain processes pain signals. Doctors will prescribe very low, targeted doses of certain antidepressants like amitriptyline or anti-seizure medications like gabapentin.
Right, and there was one specific pharmaceutical intervention in the sources that really stood out to me: clonazepam. Usually that is an anti-anxiety pill that you swallow to calm your central nervous system, right, like for panic attacks.
Yes, but for burning mouth syndrome, the application changes entirely. Doctors prescribe it as a topical mouth rinse.
A topical rinse, how does that work?
The patient dissolves the tablet in water, swishes it around the mouth for a few minutes to directly bathe the local nerve endings, and then spits it out.
Oh, so you don't swallow it at all.
Exactly. This allows the medication to chemically desensitize the hyperactive nerves in the tongue and cheeks without causing the heavy systemic drowsiness that comes from swallowing it.
Targeted local suppression. That is brilliant. The literature also notes that for those looking for an over-the-counter route, alpha-lipoic acid is incredibly useful.
Yes, ALA is a powerful antioxidant that has proven clinical efficacy in reducing nerve pain and helping damaged nerves physically repair themselves.
And finally, the sources dedicate a lot of time to stress management, which feels like a catch-all, but it actually has a biological basis here.
It absolutely does. Stress management is a clinical necessity for neuropathic pain. High cortisol levels and anxiety actively lower the threshold for pain in the brain, meaning you feel that burning sensation far more intensely.
So therapies like cognitive behavioral therapy.
Yes, CBT helps rewire the brain's reaction to the sensory input, which tangibly reduces the severity of the symptoms.
Okay, so to sum all this up, if you are standing in front of that bathroom mirror right now, sticking your tongue out and wondering why your mouth tastes like a battery or feels like a sunburn, please know this: it is a real biological chain reaction.
It is not in your head.
No. Whether it is a drop in estrogen shutting down your saliva production, a lack of zinc starving your taste buds, or your blood pressure medication disrupting your mouth's chemistry, there is a tangible cause.
And because it is rooted in biology and neurology, it can be methodically tracked down and treated. We often view the mouth merely as a mechanical chute for food.
Right.
But synthesizing everything in the literature, it's clear the mouth acts as a highly sensitive diagnostic dashboard for the entire body. When your sense of taste shifts or your nerves begin to burn, your nutritional status, your nervous system, and your endocrine system are sending you an unignorable alert.
You really have to advocate for yourself. Do not let a healthcare provider pat you on the back and dismiss it as just stress without doing the diagnostic work.
Ask for the comprehensive blood panel.
Yes. Review your medications. Demand that they consider your hormonal baseline. And honestly, looking at how sensitive our taste buds and saliva are to systemic changes, it makes you wonder about the future of diagnostics.
How so?
Well, if a drop in trace minerals or an early neurological shift alters the chemistry of our mouth this drastically, maybe the future of medicine isn't a needle in the arm. Maybe your next annual physical won't start with a blood draw, but with a highly calibrated chemical taste test to detect diseases before you even feel sick. It's something to think about.
That is a fascinating thought.
It's something for you all to mull over. Until next time, keep driving deep.